Hello, welcome to Medicare 80/20. I'm your host, Shauna. The first episode of Medicare 80/20, we discussed where Medicare got its start. And during the second episode, we discussed how anyone who is eligible for Medicare or anyone new to Medicare can go to a local organization and get help in understanding Medicare better and finding a Medicare health plan that will meet your needs. Now, we're about to start the third episode of Medicare 80/20, and this time I wanted to share how one can gain more information on one's own through the Medicare and You for 2023 handbook. It comes out every year, and it will help you get a better understanding of how Medicare works. For instance, if we were to look at the first few pages of the Medicare and You handbook for 2023, it will tell us about what's new and important for 2023 in Medicare. It starts off with Medicare 19 updates. Medicare continues to cover coronavirus disease 2019, COVID-19, vaccines, tests, and booster shots if you're eligible. And then we're instructed to see page 37. I'm going to come back to page 2 of the Medicare handbook. And under the topic at the bottom of page 2, it discusses if one needs information in an accessible format or another language. You can get the Medicare and You handbook in an accessible format at no cost to you. See page 128. And on page 128, it says, Medicare provides free auxiliary aids and services, including information in accessible formats like Braille, large print, data or audio files, relay services, and TTY communications. If you request information in an accessible format, you won't be disadvantaged by any additional time necessary to provide it. This means you'll get extra time to take any action if there's a delay in fulfilling your request. To request Medicare or Marketplace information in an accessible format, you can call us at 1-800-MEDICARE or 1-800-633-4227. For TTY users, please call 1-877-486-2048. Or you can send Medicare a fax to 1-844-530-3676. You can also send them a letter to the Centers for Medicare and Medicaid Services, Offices of Hearings and Inquiries. It says on page 18, under Special Enrollment Period, after your initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. For example, if you didn't sign up for Part B or Part A if you have to buy it, when you were first eligible because you have group health plan coverage based on current employment, your own, a spouse's, or a family member's, if you have a disability, you can sign up for Part A and or Part B anytime you're still covered by the group health plan or during the 8th month period that begins the month after the employment ends or the coverage ends, whichever happens first. Usually you won't have to pay a late enrollment penalty if you sign up during a special enrollment period. This period doesn't apply if you're eligible for Medicare based on end-stage renal disease, ESRD, or you're still in your initial enrollment period. And it makes note, if you have a disability and the group health plan coverage is based on a family member's current employment, other than a spouse, the employer offering the group health plan must have 100 or more employees for you to get a special enrollment period. Now, going back to page 2, under new state dates for your Medicare coverage, beginning January 1st, 2023, when you sign up for Medicare, the month you turned 65 or during the last 3 months of your initial enrollment period or during the general enrollment period, your coverage starts the first day of the month after you sign up. And for more information on this, we're instructed to see pages 17 and 18. And going to pages 17 and 18, it says, if I didn't get Part A and Part B automatically, when can I sign up? If you didn't automatically get premium-free Part A, for example, because you're still working or not yet getting Social Security or Railroad Retirement Board RRB benefits, you can sign up for it anytime after you're first eligible for Medicare. See page 22 for more information. It goes on, in this example, your Part A coverage will go back retroactively 6 months from when you sign up for Part A or apply for Social Security or RRB benefits, but no earlier than the first month you're eligible for Medicare. Depending on how you become eligible for Part A, the retroactive period may be different. Note, you can only sign up for Part B during the eligible periods listed below. And it notes, remember, in most cases, if you didn't sign up for Part A, if you have to buy it, and Part B when you're first eligible, your enrollment may be delayed and you may have to pay a late enrollment penalty. And for more information on that, we're instructed to see pages 22 and 23. It goes on page 17. What are the Part A and Part B enrollment periods? You can only sign up for Part B or Part A if you have to buy it during these enrollment periods. Initial enrollment period. You can first sign up for Part A and or Part B during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. If you sign up for Part A and or Part B during the first 3 months of your initial enrollment period, in most cases, your coverage begins the first day of your birthday month. However, if your birthday is on the first day of the month, your coverage starts the first day of the prior month. If you sign up for and are paying for Part A and or Part B the month you turn 65 or during the last 3 months of your initial enrollment period, the start date for your Part B coverage will be delayed in 2022. Under new, beginning January 1st, 2023, if you sign up the month you turn 65 or during the last 3 months of your initial enrollment period, your coverage starts the first day of the month after you sign up. And it goes on page 18. We already discussed or read special enrollment period, so I'm going to skip down to the midsection where it says important. COBRA, Consolidated Omnibus Budget Reconciliation Act coverage, retiree health plans, VA coverage, and individual health insurance coverage, like coverage through the health insurance marketplace, aren't considered coverage based on current employment. There may be reasons why you should take Part B instead of or in addition to COBRA coverage. You have 8 months after your coverage based on current employment ends to sign up for Part B without a penalty, whether or not you choose COBRA. You aren't eligible for a special enrollment period to sign up for Medicare when that COBRA coverage ends. To avoid paying a higher premium, make sure you sign up for Medicare when you're first eligible. See page 88 for more information about COBRA coverage. If you have retiree coverage, it may not pay for your health services if you don't have both Part A and Part B. And also under new, it says there are other circumstances where you may be able to sign up for Medicare during a special enrollment period. Beginning January 1st, 2023, you may be eligible for a special enrollment period if you miss an enrollment period because of certain exceptional circumstances, like being impacted by a natural disaster or an emergency, incarceration, or losing Medicaid coverage. For more information, visit Medicare.gov or call 1-800-MEDICARE, which is 1-800-633-4227. TTY users can call 1-877-486-2048. And under general enrollment period, if you have to pay for Part A but don't sign up for it, and or don't sign up for Part B, for which you must pay premiums, during your initial enrollment period, and you don't qualify for a special enrollment period, you can sign up during the general enrollment period from January 1st to March 31st each year. You may have to pay a higher Part A and or Part B premium for late enrollment. See pages 22 to 23. And going back to page 2, under kidney transplants and immunosuppressive drug coverage, Medicare will offer a new benefit that helps continue to pay for immunosuppressive drugs beyond 36 months after a kidney transplant if you don't have other health coverage. And for more information on that, we're instructed to see page 52. Under Learn How Accountable Care Organizations Can Drive Better Health Care, it says, an accountable care organization is a group of doctors, hospitals, and other healthcare providers that work as a team to give you high-quality, coordinated healthcare. If your doctor is part of an accountable care organization, it means they have tools that could lead to better care for you, and you may have access to additional services. See page 111. Under Get Help Paying Your Medicare Health and Drug Costs, if you have limited income, you may be able to get help from your state to pay your Medicare costs through resources like Extra Help or a Medicare savings program. And for more information on this, we're instructed to see pages 91 to 96. Under Get Help in a Crisis, your mental health and wellness are a high priority. If you or someone you know is in crisis, call or text 988 or chat 988lifeline.org. That's just the first page of this book. There's still a lot more to go through. But I'd like to stop here because I have a lovely video that I'd like to share with you. A lot of people, once they reach the age of 65 and it's around the time that they retire, some retire at this time, some perhaps work a little longer. And under either situation, there are many people who happen to be eligible for Medicare who are still providing wonderful, successful help to the community. And I'd like to showcase one of those individuals. Her name was Liz Smothers. She's no longer with us, but I had the good fortune of being a classmate of her son, Tim Smothers. And recently, Tim and I had like a 2-person class reunion, and he shared with me the wonderful success that Mrs. Smothers, his mother, had with the Julian Pie Company. That is a company in California And from what I'm told, they make the most delicious apple pies. Mrs. Smothers' story was shared on the Today Show recently, and Tim was kind enough to grant me permission to share that video with you. I'd like you to take a look at it. It's very wonderfully positive and just showcases how no matter what age a person happens to be, one can lead a successful life and one can always share something wonderful and positive with their community.
Whenever she would make pies, I would crawl up on a box and take the little leftover pieces of dough and put them in a jar lid. Whatever pie she was making, apple or whatever, I would put the little apple in my jar lid and cover it, and she would bake it in the oven just along with hers, and I would eat it. I would say that if I had not had that experience, I would never be in the pie business. When we moved here, I had to go to work. The only place that a job was available was in a bakery. I tell you, after I started working with pie making, that old love just came right back. Wild horses couldn't have stopped me. And honestly, I was not thinking of how much money can I make. I just was dying to make a good pie like my mother made, you know. And it's been a real treat to serve the public and be able to put out a product that I remember thinking, and you even get paid for it, you know. The method that we use now, 30 years later, is the same one we started with then. And you just never get tired of hearing, in this age of Facebook and all that, it's just wonderful to hear that they enjoy it. It's nice to create something that people really enjoy. It will always be our desire to make the best pie that we can, keep it clean and neat, and make something that they can really enjoy.
I just wanted to give a special thank you to Tim Smothers and the wonderful people at the Julian Pie Company for sharing your wonderful story. Delicious. Well, I really hope you enjoyed that video of Mrs. Smothers and Tim Smothers and his family. I was really enthused when I saw it. It was just very exciting to see someone I knew and grew up with on TV. That's always fun. But what I was most impressed by and most encouraged by was their story. This woman took a situation that a lot of us have been in, may be in now, or perhaps we may be in the future. But she took a situation that was tough, and she made something really wonderful and beautiful out of it because of her hard work and her love and support of her family. And that's something we all want, and hopefully we all can have. For Medicare 80/20, I'm your host, Shauna, and as always, I hope that you maintain wellness and add to your happiness. Hasta luego, y'all.
We had a third world for healthcare.
The population that had never seen a physician in their life.
Healthcare had been what people on the plantation knew about things that grew and they had access to.
This is the remarkable story of how civil rights activists and the federal government desegregated thousands of hospitals practically overnight, bringing life-saving care to millions of Americans.